Metropolitan University. We're going to meet Marianna Newton, who has Parkinson's disease. Let's go check it out. So, thanks very much for coming on the show. How are you doing?
Good.
Good. So, what can you tell me about your experience of Parkinson's so far?
So, I was diagnosed with young onset Parkinson's disease when I was 22 years old. I've had it for 7 years now. I experience tremors and bradykinesia, which is slow movements, and sometimes it affects my speech and my reactions to things. I'm quite slow. So it was quite a shock really, because only about 5 to 10% of people under 50 develop Parkinson's, and it's exactly the same as you would expect in an older person over 60 or whatever. So it was quite a shock to know that I've got it.
One person in every 500 has Parkinson's. That's about 127,000 people in the UK. Most people who get Parkinson's are aged 50 or over, but younger people can get it as well. 1 in 20 is under the age of 40. So we know who's affected by Parkinson's disease. But what exactly is it?
My understanding of Parkinson's is that I don't have, or I don't use my levels of dopamine in the brain, which is a chemical that helps my cells sort of communicate in the brain. So hence I sort of get these misfirings, and I get the symptoms that I have now. So with this first medication that I was prescribed, these MAO inhibitors, what this tended to do was help slow down the process of breaking down the dopamine that was being released in my brain, and so that I could use it basically, and hopefully that would stop tremors and various symptoms, but that didn't help. So after that I was put on to dopamine agonists, which is basically all of the cells that were taking in the dopamine were sort of multiplied, so I had more space basically to take in more dopamine, again to increase dopamine levels, etc. But that didn't work very well. So finally what I'm on now, and what tends to be the most common medication or form of medication, especially after 5 years, is L-Dopa, which is levodopa, which basically increases my dopamine levels so that I can function better. And I do find that it has helped more than anything else.
When diagnosed with Parkinson's, like Marianna, most patients receive drug treatments first, and the aim is to increase the level of dopamine that reaches the brain, which stimulates the parts of the brain where the dopamine works. However, all prescribed drugs can have potential side effects, including those used to treat Parkinson's. Some characteristics you think are symptomatic of Parkinson's may actually be side effects of the medication. But Marianna has taken a plethora of drugs to combat her Parkinson's symptoms, but none appear to be very effective. Currently, she takes L-Dopa, which is levodopa. Now, in the early days of taking L-Dopa, you may feel sickness or nausea, but in most people this is mild and it will pass as your body adjusts to the drug. However, Marianna experiences one of the main problems with L-Dopa, which is a side effect called dyskinesia. These are involuntary movements and can increase over time. If medication doesn't appear to be the best solution to Marianne's Parkinson's, what are the other options available?
Deep Brain Stimulation, one of the members of the support group that I'm with for Parkinson's, I've been referred to by my doctor consultant. He suggested, he has undergone DBS stimulation, which is brain surgery, but it is quite an intense sort of form therapy, but he functions completely fine now. And you wouldn't even see, to look at him, you wouldn't see that he's got Parkinson's. His tremors stopped completely,
Right.
and he's functioning really well. And to have that would be perfect because, at the age that I am, it's I see people my age and they're functioning completely fine.
A few weeks after filming, Marianna arranged to see a neuropsychologist to talk about the eligibility and the practicality of having deep brain stimulation. Whether Marianna meets the criteria remains to be seen. I recently caught up with Stephen Fulster, who's an expert in Parkinson's, who had this to say.
Symptoms of Parkinson's disease develop because cells in the portion of the brain known as the basal ganglia die. Now, the basal ganglia is an area of the brain located towards the back of your head, which is known as the cerebellum. This is responsible for all the movements we don't even think about, such as walking. Now, dopamine is a neurotransmitter. A neurotransmitter is a chemical that is released by a brain cell that binds to a nearby brain cell. This continuing process results with different parts of the brain communicating with each other and the rest of the body. Now, within the basal ganglia, there is a collection of cells called the substantial nigra. The cells of the substantial nigra produce dopamine, which plays an important role in sending signals to our body regarding movement. Now, in Parkinson's disease, these cells die, resulting in the producing of less dopamine than normal. Now, in deep brain stimulation, high-frequency electrical pulses are applied via wires to one of several locations in the basal ganglia. DBS requires surgery in which a device, such as a pacemaker, would provide electrical stimulation. Now, this is placed under the skin of the chest, while its wires are threaded into the brain. Now, this electrical stimulation is thought to block the signals that cause the disabling motor symptoms in Parkinson's disease. The extent of stimulation can be adjusted by an experienced neurologist using a handheld device that is placed on the surface of the skin, just above the site where the device was placed. This is typically just below the collarbone. Now, patients are given a local anaesthetic and sedation so that they won't feel any pain when the skull is cut. However, during the first part of the procedure, patient cooperation is required, so the patient, while kept drowsy, has to be awake. Now, during the second part of the operation, when the battery is placed under the collarbone, patients are put under general anaesthetic. Typically, several weeks after surgical procedures are complete, the patient returns to the neurologist's office to have the stimulator turned on and the settings adjusted.
Although deep brain stimulation is considered a safe treatment, there are risks associated with it as the therapy requires brain surgery, making it only suitable for certain patients who are in good physical health and able to cope with the stress associated with major surgical procedures. Surgery involving the brain can cause serious complications if not successful, including bleeding caused by blood vessel damage. The probability of serious damage caused by bleeding is low. For example, stroke affects 2% of patients during or just after surgery on average. However, if it occurs, the resulting effect can be permanent. The effects of stroke range from mild weakness that gradually improves to severe permanent weakness and impaired intellectual functioning. The system, once implanted, may become infected, but the infection is usually treatable and mild. Components may move and encounter electrical problems, causing the system to stop working and symptoms of Parkinson's to return, which requires further surgery to resolve and a new system implanted if necessary. The side effects of DBS vary from patient to patient, but common effects include minor sensory and motor control issues. Post-surgery, side effects can include seizures, temporary pain and swelling around the implantation site, headaches and problems of sleeping. Due to all the known risks and side effects, it's very important for the risks and potential benefits of surgery to be weighed up before a decision is made over whether to pursue DBS as a viable treatment for Parkinson's disease.
How did your meeting go?
Really well, yeah. It's promising. I know that there's some there's long-term effectiveness.
Okay.
Yeah, we'll see how it goes. I still have to take medication.
Yeah.
But it should be. It's promising and it's promising.
Marianna's right. Her candidacy for DBS is looking strong. 80,000 patients have received the procedure worldwide, and Marianna appears to fit this candidacy rather well. We do know that she experiences tremors which haven't responded to medication, and she has experienced troublesome dyskinesia. Furthermore, we know that she's been taking L-Dopa for the last 5 years. But it is important to remember that DBS is not a cure. If Marianna is successful with the DBS, it does not benefit postural instability, gait, balance and cognition. Furthermore, there's always the risk of infected leads, and a battery replacement is required every 3 to 5 years.